Hey guys, this is Dr. Babes and welcome to another sweet episode of The Good Doctor. In our previous videos, we have discussed the most common type of diabetes, type 1 and type 2. But let's not forget another type of diabetes which occurs in a very special population, the moms-to-be. Gestational diabetes is a transient form of diabetes. The word gestational implies that this is induced by pregnancy. Just a little recap. Remember that when we eat our food, we digest it and our body turns it into glucose or what we call blood sugar. However, it can't enter the cells alone to use it for energy, so it needs a little help from our friend insulin. When insulin is either deficient or not used effectively, glucose cannot enter the cells. It stays in the blood, causing high blood sugar levels. If it builds up or becomes uncontrolled over time, it becomes a problem. In pregnancy, carbohydrate metabolism is slightly exaggerated, leading to high blood sugar levels. Although the exact cause of gestational diabetes is not clear, hormones during pregnancy could play a direct or indirect role. Studies have shown that the cases of gestational diabetes in pregnant women is on the rise. Any women can actually develop gestational diabetes. Even famous celebrities like Mariah Carey and actress Angelina Jolie had gestational diabetes when they were pregnant. The actress even said that her feet got so swollen that she had to buy and wear bigger shoes. But those who are overweight or have family or personal history are at higher risk. Other risk factors include advancing age and having previously given birth to a large baby. Most women don't have any symptoms of gestational diabetes. Others may experience increased thirst, increased urination, fatigue, or even vaginal infections. But what's confusing is that all of those are general pregnancy symptoms. That's why your doctor or obstetrician may order a screening test to check if you have gestational diabetes. It is called an oral glucose tolerance test, and it is done usually 24 to 28th week of pregnancy. For the test, you are going to take a glucose drink that contains 50 grams of sugar. It usually tastes like orange or lime to make it more palatable. After 1 hour, your blood sugar levels are checked. This test is sometimes called the 1-hour test for that reason. There are certain cutoff values to know if you are at risk or not. So if you didn't meet the cutoff, do you automatically have gestational diabetes? No, not yet. But this means that if you fail the 1-hour test, it means you're at risk of developing gestational diabetes. You'll need to take a second test though, to officially confirm the diabetes or not. The test is similar except that the sugar dosage is higher, usually 75 grams or 100 grams, and you have to wait for 2 or 3 hours respectively instead of just 1. If your blood sugar is still above the cutoff, you're diagnosed with gestational diabetes. But don't worry, mommies. The good news is, most of these cases can be managed with just good diet and exercise. But also make sure that you have regular prenatal checkups with your doctor to be sure that your blood sugar is in good range, as you don't want to deal with complications of unmanaged diabetes. Because of the constant high glucose levels in the mother's blood, the fetus may receive too much nutrients and grow too large. That is what we call macrosomia, which can actually complicate the birth process and may even need a cesarean section for delivery. And because the baby is exposed to high levels of glucose, the baby's body also responds by producing more insulin than usual. Shortly after delivery, the high blood sugar exposure from the mother is cut off, but the insulin level of the baby remains high. So now the baby's blood sugar can suddenly drop and be very low, which can be quite dangerous. The newborn's blood sugar level must therefore be monitored and corrected with prompt feeding, or if necessary, with intravenous glucose. High blood sugar may also increase the mother's blood pressure and risk of preterm birth. future diabetes in both mother and child is also more likely to occur. So to all moms out there is no need to panic if you have gestational diabetes. Gestational diabetes can be successfully managed or even prevented with healthy diet, physical exercise, and by keeping a healthy weight before and during pregnancy.
Wait a minute! Who are you?
If you haven't checked my previous video on ways on how to lower down your blood sugar, make sure to check them out. In some cases, however, medication or insulin injection may be needed, so it is best to embrace those regular prenatal checkups to help you get ready for the big day and to a healthy, happy beginning with your little bundle of joy. Some moms dread the glucose test because of its taste, and that's why today, we decided to do a taste test through the Imposter Challenge. Today, we invited the rest of our team to do this challenge where they have to taste two identical things. One tastes good and the other does not. They must drink what they are presented with while trying to convince the viewers and me that they like the taste.
Nice.
Then the viewers will guess who they think drank the gross thing. We have our pharmacist here today to assist us, and she has two glasses. One of them contains a normal orange juice, and the other one contains the orange-flavored glucose drink.
Now you have to guess which one of them drank the glucose drink, and the goal is for you not to find out.
So just a disclaimer, only our pharmacist knows which one is which. So let's call them up. Wow! So, are you ready, guys, for our challenge today?
Ready, go!
So our pharmacist will hand each of them a glass. And, okay, we'll start with one of our editors.
It was at this moment that he knew he fucked up.
Okay, now next, our other editor. I actually can't decide who drank the orange flavored drink or the orange juice, but for my guess, I think the one who drank the glucose drink was our senior editor, Sir Alvin. But let us ask our pharmacist, who is the imposter? Imposter.
Victory!
So did you guys guess it right? State your votes in the comments below. And for those who got it correctly, you win a free consultation from us. Just click the link provided. And for those who didn't, don't worry, we can access it too. So if you enjoyed our video today, don't forget to click the subscribe button and hit that bell button for more healthcare tips and medical advice. That's it for today, and this has been your good doctor. And thank you for watching!
To proceed with free online consultation, click the link in the comments section.